So, Assalamu alaikum, a very good afternoon, good evening, good morning, wherever you are joining us from different parts of the world. I'm Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine, and also an Associate Professor of Clinical Population Health Sciences. So, I would like to thank each of you for joining us today for this Population Health and Wellbeing series. As you may know, the objectives of this series are to discuss contemporary and critical topics which are relevant to healthcare, medicine, and population health. We also examine evidence-based practices which are germane to public health and patient care. We also describe opportunities and challenges in the evolving face of healthcare and population health. So just some housekeeping, your cameras and microphones, they have been turned off. You can use the Q&A tab to type your questions and comments. You can also actually just post them in the chat feature, and we will be able to view your questions and comments. I will be moderating the question at the end of the session. This is, of course, a CME event. It's accredited both by ACCME and by DHP here from the Ministry of Public Health. I just wanted to reiterate to everybody who is joining us, the healthcare practitioners from Qatar. Basically, everybody knows that there was a circular from the Ministry of Public Health, and what it said was that recording attendance of DHP-accredited CPD activities conducted in the state of Qatar in the e-portfolio accounts of healthcare practitioners, you are required to provide your Qatari ID number and MOPH license number to your CPD provider. Now, you have to ensure that your Qatar ID and MOPH license number, they match the registration and licensure details in the Ministry of Public Health's database. This allows us to record attendance accurately as required by the Department of Healthcare Professions. What we are requesting you to do, that if you haven't already, please update your profile on Cloud CME. Cloud CME, as you know, is WCMQ's registration portal where you have registered for this seminar discussion. So once you've signed in into your Cloud CME account, you will click the yellow My CE button. On the right side, you will select Profile and then review and update the fields as required. Since you are attending this session today, the deadline to update your profile is today. So please make sure that you update it so we can, then upload the correct number of credits for you on the system. So if you have not uploaded your Qatar ID number and license number, we will not be able to give you the due credit. So the post-activity evaluation, it'll be available in your Cloud CME account by August the 22nd. And extremely important, that you update your information on the Cloud CME account, both your Qatar ID number and MOPH license number. So you'll receive an email notification once the evaluation is available in your Cloud CME account, and your certificates will be available for download once you complete the post-activity evaluation on our portal. So now, coming on to the session. So the topic, of course, is very close to my heart also, so I'm really excited. And it gives me great honor to introduce our speaker for today. Our speaker is Dr. Liana Lianov. She's a visionary global leader in lifestyle medicine and positive health. She's the driving force behind the development of the groundbreaking lifestyle medicine core competencies, and she has really played a pivotal role in shaping the future of healthcare. She received the 2022 Trailblazer Award from the American College of Lifestyle Medicine. She is the president and founder of the Global Positive Health Institute, and she serves as an assistant professor at the Center for Positive Health Sciences at Royal College of Surgeons, Ireland, RCSI University of Medical and Health Sciences. Dr. Lianov's leadership extends to her role as lead faculty for the ACLM Physician and Health Professional Wellbeing course, as well as chair of the ACLM Happiness Science and Positive Health Committee. She has also served as ACLM President, American Board of Lifestyle Medicine founding Vice Chair, Positive Health and Wellbeing Division President at the International Positive Psychology Association, American Medical Association, Healthy Lifestyles Division's Director, and American College of Preventive Medicine Board Regent. She's a highly sought after international speaker, and she has shared her expertise on various platforms through insightful scholarly articles and books. She's an editor of a pioneering book, Roots of Positive Change, Optimizing Healthcare with Positive Psychology, and co-edited the Routledge International Handbook of Positive Health Sciences. She has also recently released her book, Practicing Lifestyle Medicine from the Inside Out, Using Positive Psychology in Healthy Lifestyles for Positive Health. Dr. Lianov, thank you so much for joining us today, and really looking forward, and over to you.
Thank you so much for that kind introduction. And I'm absolutely delighted to be here and to be speaking on my favorite topic in medicine and healthcare. And I hope to help change the world a little bit, even by igniting a passion in all of my colleagues and our patients in this area of positive health. So I'm going to share my slides. Okay. I have nothing to disclose in terms of conflict of interest. And to dive in, what I'll be covering with you today is I'll describe the role of positive psychology in an effective healthcare practice and how that helps us to achieve and facilitate positive health with our patients. And also we'll talk a little bit about helping ourselves as well, and examine this fascinating and very important reciprocal reinforcing relationship between healthy lifestyles and positive emotions and beyond. As you'll see, it's not just positive emotions. And then we'll take a very brief look at how we might be able to apply these kinds of positive psychology approaches in clinical care. We can prescribe them as part of a comprehensive healthy lifestyle approach for prevention and treatment of disease, and to help ourselves and our patients actually thrive and grow and become our best selves no matter what. So we have a poll question. How often do you use positive psychology techniques in clinical care?
Can we end the poll now, Dr. Liana?
Sure. We'll go ahead and close the poll.
I'm sharing the results now. Dr. Liana, are you able to see the results?
Yes, I see the results, and it's wonderful to see that half of you who responded or were able to respond, 50%, are using some of these positive psychology techniques with most patients to support them in making changes and beyond. And that's wonderful to see. And maybe because you have an interest in this area, you're joining us today. And I hope you'll learn a little bit more if you're already using them. And if you're thinking about it, you're not too sure, I hope that by the end of today's session, I'll nudge you to at least think about it and maybe do one or two little things in your clinical care practice to take advantage of this wonderful area of positive psychology to help your patients. So let's move on. So when we talk about healthy lifestyles, particularly in the lifestyle medicine community, and how we framed it at the American College of Lifestyle Medicine, but really at this point, globally, we talk about healthy lifestyles with 6 pillars. And I'm sure you're all familiar with these pillars: physical activity, a predominantly whole food, plant-based eating pattern, nutrition, getting restorative sleep for 7 to 9 hours a night, avoiding risky substance use or reducing harm from misuse, managing our stress. And usually the 6th pillar is just called social connection. And absolutely, that is so powerful. And as we'll see, it's maybe the most powerful element in our lives for our emotional, mental, and physical well-being. But I have in recent years expanded that 6th pillar and called it the positive psychology pillar that we'll dive into. And you can see there's positive emotions, engagement, relationships, meaning, and achievement. We'll take a look at those, but the heart of that is relationships, which is social connection. So the 6th pillar includes the social connection, but it goes beyond. And I'm making the case that we can go beyond and should go beyond, and that this should not only be something we recommend to our patients, but it's a style and a way of changing our practice to, again, help our patients, help ourselves, and be more effective and more satisfied with our clinical practices. And this is another graphic that shows this information in a different way, all those 6 pillars. And you can see the blue box connecting the 6 pillars, which is positive psychology, positive emotion, and actually beyond positive emotion. So sometimes people who are not very familiar with positive psychology think it's about being positive or being happy all the time. And it's not always about that. We want to increase positive emotion and happy feelings, of course, feelings of joy, optimism, hope. But we also want to, and very importantly, increase feelings of meaning, purpose. For some people, it's also feelings of connection to the world, spirituality, sometimes religious beliefs that connect us to ourselves, others, again, and the world around us. These are all powerful feelings. And we also, as we strive to build those feelings, which then are built around these healthy pillars, and these healthy pillars help us to engage in these kinds of emotions. These emotions, and particularly positive emotions, can help us to be successful with healthy behaviors. But ultimately, we also need to acknowledge that we're human and we're not going to be positive all the time or happy all the time. We have a full range of emotions. It's called emo-diversity, and that's okay. A big part of positive psychology is having some self-compassion. We embrace all of our feelings. We acknowledge them, and we gently, kindly, being kind to ourselves, move in directions that help us to really harness the best emotions that will help us, again, emotionally, mentally, and physically help us with our health behaviors. And there are a number of studies that show what I've been calling this reinforcing reciprocal link between healthy lifestyles and especially positive emotions. So each of these pillars it increases positive emotions, and positive emotions, when associated with healthy behaviors, make it more likely that we will achieve and sustain these very important healthy habits that provide the foundation for effective lifestyle medicine. So I've already mentioned some of this on this next slide. So positive psychology is an area that's key for managing stress, strengthening mood disorder treatment and beyond, helping with mental health, helps with emotional well-being, helps with healthy behaviors. It has direct physiologic benefits. And ultimately, all of that comes together to help us achieve positive health. And of course, in clinical care, also we care about successful provider-patient interactions, which help us to be more satisfied as practitioners, and it can help to prevent burnout. So then when we go beyond, I've been talking about a little bit about what positive psychology is. It's this focus on the positive aspects of our lives, but again, acknowledging that we have the full range of emotions, but we move to positive aspects. And even when our whole world is crumbling around us, we can look within us and look for our strengths, our character strengths. We can look at other ways that we can be resilient, we can thrive and become, there's a word now that's being used, become anti-fragile. So the world throws many things our way, many difficulties, and we can harness those difficulties to grow and thrive and become even better versions of ourselves. And this is very possible. So as we do all of this, we're moving in a direction of positive health. And so positive health is achieved then by engaging in these traditional health behaviors that are part of lifestyle medicine, a comprehensive healthy lifestyle, but also positive health is achieved when we add these positive psychology factors. And the science shows that these are independently protective for our health and well-being. So it's these healthy habits plus positive psychology-based activities that we'll take a look at in more detail. And it's in the context of other factors in that larger biopsychosocial model, our environment, and how we interact with our environment and a supportive environment. And all of that together helps us, again, to cope, to thrive, and to become anti-fragile and become our best selves. There are now many, many studies in the field of positive psychology and health and well-being. One of these, and there are several major meta-analyses that have looked at this. This is slide shows one of these meta-analysis by Hendricks, and they looked at a wide range of positive psychology interventions. These are just a few of the top interventions that they looked at. And the point being is there are many ways to engage and do activities that fall under this umbrella called positive psychology. And in these meta-analyses, like the Hendricks meta-analysis, when they put all those interventions into the study and looked at the data, that even though we have such a wide variety of interventions and also wide variety of quality of the studies, they weren't all perfect studies. But despite that, they were able to show that there is a statistically significant impact on psychological and subjective well-being for the populations, the groups that were studied. It's small, but statistically significant. And of course, it's going to be small because, again, we've diluted the effects across so many different interventions, across different populations, across different quality of studies. And as this field of positive psychology grows, we're going to hone in on which kinds of interventions work best with which populations and in which situations, so that I am hopeful we'll have continue to have not only statistically significant results, but even more impactful results that can be shown in the literature. And in the meantime, though, there's enough evidence here, and not just in this meta-analysis, but there are about 6 or 7 other major meta-analyses. Only a couple of them are equivocal in their results. Again, that's no surprise considering what I've just explained, that there is enough evidence here to say, we should be paying attention to this as individuals and as health practitioners. And so one aspect of positive psychology is being happier. It's not the whole story, but we are interested in this piece. And then it's interesting that, of course, in medicine, we want people to live a happier and a longer life. And it's great that happier individuals do tend to live longer. And there's evidence for that. And so then what are those mediating mechanisms? And these are the mediating mechanisms, the physiologic benefits of healthy lifestyles in combination with these positive psychology-based activities, like what was on in that study in the prior slide. So these kinds of interventions and activities lead to cardiovascular health, which is really tied to our parasympathetic nervous system. That's the tend and befriend part of our nervous system. Is the opposite of the stress system, the opposite of the sympathetic nervous system. Also, being happier lowers our inflammation. We know inflammation is the underlying major the pathology behind so many chronic diseases that we're looking to prevent and treat. Happier people have stronger immune systems. There are studies that show that people who are happier and exposed to positive activities, for example, can have at least lower symptoms from having a upper respiratory disease, for example, or they're exposed to infections and they don't show symptoms. So that's very exciting and interesting. Of course, again, we're looking at living longer, and there are longer telomeres that are associated with living longer, and longer telomeres are also associated with happier people. We have better hormone regulation, which is involved in all of this. And as I made the case, we can happier people, positive emotions tied to healthy behaviors helps us to achieve and maintain those healthy behaviors. So all of these are the mechanisms that help us to be happier, to be physically healthier, and to live longer. So before I go on, though, I do want to emphasize, and I'm very aware that I am speaking to a multicultural audience, and we are aware in the literature and in the science and field of positive psychology and positive health that your cultural background is going to make a difference in the kind of impact that the PPI as a positive psychology intervention will have for any individual. We know that, of course, the overall essence of positive psychology comes from ancient wisdoms. It's been here a long time. And then what has happened is that it's been modernized, and the person who's considered sort of the father or a founder of modern positive psychology is Dr. Martin Seligman at the University of Pennsylvania. And the way that we have then created the field of positive psychology has a little bit of I have to admit, a Western bias. Although now it's positive psychology is taken off, and there's more research all around the world, and that's being taken we look at that more seriously, and we're seeing positive results. But again, that being said, it may be that the way we're framing some of these interventions, there might be greater gains for European, Western, US audiences than Asian audiences, for example. And so we do need to continue this research for specific interventions, which ones work best for which cultures in which populations. We have a long ways to go there. In the meantime, we are aware of a wide variety of options for ourselves, and we can explore and see what works for ourselves individually until we have that research. One interesting study I have at the bottom of the slide here, it shows that if we, for example, in this study, they compared US participants and Korean participants, and they did this rotating intervention of acts of kindness versus gratitude letter, which comes first and what is the impact. And they found that with Korean participants, the acts of kindness first, before writing a gratitude letter, because that first intervention is more powerful, produced better results, and that for the US participants, it was the opposite. Writing the gratitude letter was more powerful in doing that before the acts of kindness. And there are many theories behind this, but one main theory is that in Asian cultures tend to be more collectivist, and practicing gratitude may be a sign of indebtedness, a sign that maybe I should have done more for you. You did so much for me. These are just theories at this point, but it's very fascinating research, and I'm hoping that we will learn more in the future. In the meantime, we say, hey, here are a wide variety of positive psychology interventions, and we need to discover and experiment to see what works best for us. And because there's so many interventions, it's great to have this mnemonic, PERMA. And this is very commonly used in the field of positive psychology and beyond. And it stands for positive emotions, engagement, relationships, meaning, and achievement. And I had this in the earlier slide. It doesn't cover everything, but it covers the main areas of positive psychology. And it's so commonly used now, it's almost become, in English, it's become a verb. Like, are you perma-ing today? Means, are you engaging in all these aspects of positive activities in your life to help yourself on a regular basis? So let's take a quick look at each of these. The P is positive emotions, and that's underlying so many of these activities. Again, joy, optimism, awe, hope, and that really impacts that parasympathetic nervous system. It improves our vagal tone. It increases heart rate variability and has these other wonderful physiologic benefits. Increases cortisol, lowers blood pressure, lowers blood sugars. You know, these are all goals that we have in health and medicine. It also helps us to think better. And there's a wonderful study that shows that physicians before an examination who were given a reward ahead of time. It was candy. They weren't allowed to eat the candy, but it was a little reward before the examination. Actually, they were randomized, and those that got the reward actually did better on the examination. So there's something about positive emotions that opens up our minds. There's also a theory. There's so much we can talk about. It's called broaden and build theory. So this is so good for us in so many ways. So that's the P in PERMA for positive emotions. And as I've been mentioning, that is so vital in including that as we help ourselves and help patients to build healthy lifestyles. And so there is this upward spiral theory of lifestyle change. And this was the light bulb moment for me when I was at an International Positive Psychology Association meeting, and one of the leading luminaries in the field, Dr. Barbara Fredrickson, was presenting, and she was presenting about healthy lifestyles and positive emotions. And I look around the room and I see people from all over the world in education and human resources, but only a few from healthcare and medicine. And that's when I vowed to, I'm going to get the word out that this is also important in healthcare and medicine, that we help build positive emotion in conjunction with healthy lifestyles. And the more we are associating positive emotions with those habits, the more likely we're going able to go back to them over and over again. And not only that, but build other resources called Vantage resources to support us to be even more successful. That's why it's an outward spiral of change. And so that's what this next slide shows. We start with those positive affect, positive emotions during health behaviors. Then that builds this non-conscious motivation for doing those health behaviors. We engage in those behaviors, and around we go, but we are also at the same time building these other resources. For example, a great example is that a happier person or someone who's being positive is more fun to be around. They're going to have more social connections, and those social connections have direct benefits, but also those social connections can help us to be accountable and be successful with lifestyle change. So very important reinforcing link between healthy lifestyles and positive emotions. And the next couple of slides just show examples of a couple of the healthy lifestyle pillars and the science. So physical activity is first. There's a large body of literature that shows that being physically active improves mood. It's comparable to cognitive behavioral therapy for treating depression. In some cases, it may even be more effective than medications, and it has fewer side effects. So it goes in that direction, physical activity to mood and mental and emotional well-being. But also there are separate studies, and one I show here, a prospective study where those who reported psychological well-being initially, on down the line, they were more likely to engage in physical activity. So it goes in both directions. That's why it's a reinforcing and reciprocal link. And the same with a plant-based eating pattern. So eating fruits and vegetables it helps the individuals they report feeling more calm, happier, more energetic. And this is especially true even the following day. So it predicts a positive mood the next day. If one day you had a nice, healthy meal with lots of vegetables and fruits, the next day your mood is up. It looks like we need at least 7 to 8 daily servings of fruits and vegetables to sustain this. So it goes in that direction. Fruit and vegetable consumption boosts our mood. But then there are separate studies that show the inverse, that when we are happier, we're more likely to consume fruits and vegetables. We're more likely, I say, to select the apple over the delicious chocolate cake, but we can avoid that. And it's easier to do that when we're feeling up and more energetic and more aware of. There are studies that show we're more aware of our health and well-being and what we're doing for ourselves and our health behaviors. So I had a lot to say about the P in PERMA, because there's so much research. It's so important. I'll quickly go through the other elements of PERMA. So E is for engagement. This is also called flow. It's when we engage in an activity and we're so enjoying the activity that we lose track of time and space. And it is a kind of mindfulness experience, and it might be gardening, it might be dancing, it might be making beautiful art, playing a musical instrument. This increases the positive neurotransmitters and hormones in our bodies, and is, of course, very important to our well-being. And Dr. Csikszentmihalyi, who is another leader who has now passed away in positive psychology, had spent his life researching this construct of flow, also called eustress. It's the good kind of stress. So in this chart, you see that, if you're doing an activity and it's not very challenging, you're bored. If you're doing an activity and it's too challenging, you get anxious. So what we're trying to do is engage in hobbies and other activities that are in that sweet spot, in that flow channel, where we lose, again, track of space and time, and we are one with that activity and have that wonderful mindfulness type of experience. So that's E for engagement. R for relationships. As I mentioned, this is the heart of positive psychology. It's the heart of lifestyle medicine and healthy lifestyles, because the science shows that this is the most important element for our well-being. And there are a number of very good cohort studies, longitudinal studies that have shown this. A most commonly one that is cited is the Harvard study of adult development. This was a study that was started in 1938. It's still ongoing. More than 80, almost now getting to 90 years, where they compared all the information that they collected from boys who went to Harvard. At the time, it was mostly boys, unfortunately, and they compared them with boys who were poor socioeconomic status, lived in inner city Boston. And then over the years, they followed them. They have now followed their families, so they've involved females in the study as well. And because they have all of this data, they're able to then control for confounding variables, many variables that might contribute to health and happiness, but we can control for that when we have the data. And it shows that when we do that, the single most important factor associated with our happiness, physical health, and longevity is positive relationships And that is due to that very powerful parasympathetic nervous system response, also called the tendon befriend, the opposite or fight or flight. And again, I was saying all the physiologic benefits, including that improved vagal tone, lower blood pressure, lower blood sugars. And this has become very popular now because Dr. Waldinger, who is the current principal investigator at Harvard, has recently written a book. Last year, he wrote the book, The Good Life, and he goes into a lot of detail about this. Now, I want to make a point that it's not just friends and family. We need friends and family, but we can actually have positive, authentic encounters with strangers and still have these kinds of benefits. It can be many short encounters, positive encounters throughout the day, no matter who we meet. It might be at the grocery store. It might be crossing the street with someone, an authentic hello, how are you? And our bodies feel that difference. We know when there's a authentic, positive interaction with another person. And so that this is often my response if people say, hey, you know, I don't have very many family, maybe I'm away from friends, what should I do? I say, to the extent that you can, when you're out and about, have safe but authentic positive interactions with others. And so then the research has dug deeper into that. That's these positive interpersonal processes. So expressing kindness, expressing gratitude, sharing laughter. If someone is sharing some good news, that we really celebrate with them proactively. The data is clear that this is good for us. In fact, better for us than for them when we're celebrating with them. But it's good for both parties, and it can be in groups, and it can be even in larger populations. And so high quality connections have just so many benefits. It helps us to endure, cope, thrive, buffer against illness, bolster mental health, increases our cognitive performance, faster recovery from loss and illness, shorter hospital stays, social groups that are really connected have higher levels of this psychological well-being and ultimately physical well-being. So that's R for relationships, M for meaning. And if one were to ask me, what's more important? Is it more important just to have pleasant feelings, pleasurable feelings from anything? Or is it more important to have positive emotions, but that are connected with meaning and purpose? Maybe someone's spirituality. I say, for sure, the science shows that it's meaning. That if we can derive positive emotions through our connection, what's called eudaimonia, through our meaningful activities, it might be volunteering, working for a cause that we really believe in, that is going to impact our well-being, psychological and physical, much more powerfully. And it's been shown, for example, in medicine, we're trying to get people to go in for preventive care and preventive services. There's a study that shows that there's a high connection between having life purpose and fulfilling the various preventive services that are recommended. And then the A is for achievement. We are human beings, and we strive to have goals, strive to achieve those goals, and those feelings of achievement, even if we set small goals and step by step make small achievements and celebrate those achievements and feel proud and share with others what we've achieved, then we're going to derive some well-being results from that as well. So that's PERMA. A very quick introduction. And so I wanted to spend a few minutes talking about then how this translates to healthcare. And this is what I've been working to create, because it doesn't really exist in medicine. And so this is where I'm to the best of my abilities, looking to be a trailblazer. And I hope you all can help to advance this movement, that positive psychology, and then I'm now broadening it to positive health, in healthcare is so important. And there are easy little ways we can do it. We're all very busy clinical practitioners. There's not a lot of time. So how do we do small things? Well, we have to assess for depression, anxiety, stress. When we're assessing for these, we can also ask a few questions about an individual's positive moods, about an individual's positive activities. We can measure, like if before an intake or part of an intake before an initial examination, when they're answering some questions in the review of systems, we could include some questions around life satisfaction, explore some of these activities as part of an overall healthy lifestyle prescription. We can coach healthy behaviors using, of course, motivational interviewing and other techniques, but also incorporate positive psychology with that and prescribe these kinds of activities as part of health maintenance, flourishing, and even in treatment plans. So we could do all of that. And of course, you can start small. You don't have to do all of this all at once. And so some examples, or one example of an assessment that can be done that I recommend is the Satisfaction with Life Scale. This is developed by Ed Diener, who's also a leader, probably the most published leader in positive psychology, unfortunately passed away just last year. And they did a lot of research looking at a lot of statements and which statements are most predictive of an individual's life satisfaction. And they boiled it down to these 5 statements that you rank on a Likert scale from 1 to 7, 1 strongly disagree to 7 strongly agree. And you can see that the maximum points then is going to be 35 points. And if you're somewhere in the middle or above, you're doing all right. If you're like under 20, you might need to pay attention to this. And so it's a place to start to have a conversation around this. And then I bolded the first 3 statements on purpose, because in a later publication, Dr. Diener and his colleagues found that if you really have very little time, even just these first 3 statements are almost as predictive as asking the full 5 statements. So that's an example of an assessment, an example of a prescription. Here is a meaning and purpose prescription. Just like we can prescribe physical activity and plant-based eating, we can prescribe social connection, we can prescribe meaning and purpose activities, and much more. And then the patients may, we can say that this is a serious part of a person's prevention and treatment plan. And when we give the prescription, we hope the patients will take it as seriously as I hope you will in your medical practices. And I've mentioned that, yeah, of course, we're coaching healthy behaviors. Most people know about motivational interviewing, also cognitive behavioral techniques, but we can also start thinking about, and half of you are already using positive psychology techniques, particularly in health behavior change, and that's wonderful to see. And so, but here's maybe you haven't thought about it this way, but we can take all 5 elements of PERMA and in a very purposeful way, craft those elements into a behavior that we're coaching. How do we make sure that the person experiences positive emotions with that behavior? How do we make sure the person experiences flow with that activity? How do we get them to engage others to do that activity? How do we get them to think about how meaningful that activity is, and help them also with a sense of achievement and accomplishment by building small steps, building self-efficacy as they achieve small steps towards a larger goal. And I go through this very quickly because I know I'm running short on time, but just some ideas for you to think about. And of course, I acknowledge that this is probably still can be a lot for a busy practitioner, but that's why lifestyle medicine, integrative medicine, medicine in general is a team sport. We have the physicians and all other team members that are on board to help us be successful with our practices. So we want to leverage the healthcare team. We want to leverage external resources and referrals to behavioral health professionals, health coaches, spiritual counselors, other community resources. So some of this can happen through peer-to-peer. It doesn't have to come in the setting of a medical setting. It can be in church and spiritual centers, hobby groups, senior centers, classes that are teaching individuals about engagement and engage, and really making the most out of their lives. And also, of course, there are digital apps, and look for some credible scientific-based resources for that as well. And then if you say, well, I don't know where to start, this is still a lot, then I say start one small step with, and you probably all already do this, but you can maybe a little bit more conscious of this after this talk, which is to make sure, no matter what's going on, that you slow down a little bit and have in your mind just a little bit, and be conscious that you're engaging in positive interactions. You may start every interaction with what's going well today, or since the last time I saw you, or in your life, and end every interaction with what has gone well since in our visit, or since we chatted just today. And begin on a positive note, end on a positive note. That's doesn't necessarily take much more time. You're already engaging and talking to others. This can be patients, coworkers, everyone throughout the day. It helps them, it helps you, easy to do. Please start there. And again, I'm sure you're already doing that, but this is the beginning of a positive health approach for ourselves. We need to include this in our workplaces. And we know there's a large influx of burnout, especially here in the United States, but I'm sure everywhere. And we know that the practice of lifestyle medicine, through a study that we published, I believe last year at the American College of Lifestyle Medicine, is that a lifestyle medicine practice helps with the reducing burnout. There's lower levels of burnout when we're engaging in patients in healthy lifestyles, and that can include these positive psychology approaches. And then my last couple of slides are that what I'm asking you to think about is a transformation of healthcare and medicine, to think about that on two continua. So we normally think about the illness continuum and moving patients from physical and mental illness to physical and mental health. And absolutely, that is our role. But there's another continuum. It relates, but it's separate. And it's this positive health continuum where we can help patients move from diseases of despair, loneliness, stress, trauma, low quality of life, through these various methods that I've been talking about, to becoming their best selves. And sometimes if we're stuck on the illness continuum, we may need to set that aside and focus on the positive health continuum, or at the very least tackle both of these at the same time, and they interact with each other. They will help an individual make progress on the illness continuum and help them get unstuck. And then here's another graphic. I actually didn't develop this. This is one of our colleagues, Dr. Wayne Deisinger, who developed this in their value-based care organization, where I helped them write their manifesto for medicine. And in their manifesto, they put positive psychology as the bottom of this triangle or pyramid of practice. That without some of these concepts that I've been talking about, and particularly meaning and purpose, and building on that, building healthy behaviors on up, we are very challenged. But if we can focus on that, then we can achieve prevention and treatment much easier. We can then build on that, all of the other aspects of medicine that are necessary, including, of course, healthy lifestyles, other integrative practices, sometimes still need medication, sometimes still need surgery, but it's on this positive health, positive psychology foundation. So in summary, a healthy lifestyle is in those 6 pillars: physical activity, mostly whole food, plant-based eating, sleep, stress management, avoiding risky substances, but remember PERMA, and integrating that into our lives. And then there's this reciprocal reinforcing relationship between positive emotions and healthy behavior, that this is important in behavior change, and it's an important technique, and that we can measure happiness constructs. Actually, emotions are fleeting, and so that's why I was recommending a life satisfaction evaluation, and that uses the prefrontal cortex and gives you a snapshot of where a patient is. and that we can promote positive emotions in clinical encounters, even with just a brief, what is going well for you today. And then last but not least, we do need to keep culture in mind and to recognize that and acknowledge it and look for the science and allow differences, allow our patients to find their differences and find what works for them uniquely. And as we do this, hopefully we will be starting to change the paradigm of medicine and healthcare to practice along this two continuum model. In terms of references, yes, Roots of Positive Change, there's actually a new a second edition that's coming out later this year. We have a brand new book, Lifestyle Medicine from the Inside Out, that looks at all the pillars and the science behind them and the practice. It also takes the lifestyle medicine competencies and presents them from a positive health lens. And then I also mentioned The Good Life. And I mentioned these books, even though I'm heavily involved in these books, because this is new. And there are very few other resources that exist right now that are framing this in this way. And so I'm happy to be that trailblazer. So with that, thank you so much. And please contact me at any time if you're interested in learning more and doing more and becoming engaged with what we're doing at the Global Positive Health Institute. So with that, I will stop the share and we have a few minutes left.
Great. Thank you so much, Dr. Lianov, for that wonderful presentation. So really, really insightful, and it was really a joy to listen to that. We have some questions coming in, so I'm just going to start with that. So just to start off, you alluded to the PERMA model for positive psychology. Can you just reiterate it and how, we can basically guide our patients to apply that in daily lives, to help them?
Okay, so the question, how to apply PERMA in their daily lives. As we saw there, that's just a short acronym for so many different activities that fall under that broader umbrella of positive psychology. And so we can introduce patients to this idea of PERMA and what each element means, and then encourage them to start small, start anywhere. Again, we know the social connection is very powerful, and maybe that's a good place to start, but anything that interests them, and experiment and find for themselves what their interests are and what the result is, and then build on that, because ultimately it would be great to encourage them to do all the elements in PERMA, but always with any behavior or any change, start small and build on that.
Great. Thank you. Dr. Lianov, there's a question about, is there a scale to measure well-being status?
Yes, there's, of course, the Gallup poll is very famous for having a well-being index. There are several other well-being indexes, and certainly in a clinic setting or other settings where you might have some influence, some of those kinds of assessments can be integrated on a routine basis. But mostly those well-being scales have been used more for population studies, for research. I'm not aware so much that they're being used in clinical settings. And so that's why I'm, again, very cognizant that we have limited time and capacity. And I'm always thinking, what do we do when we're in that healthcare setting? And so something like the life satisfaction score scale might be a better place to start. But yeah, of course, well-being scales are very informative.
Sure, thank you. There's a question about spirituality and about if spirituality plays a role in health systems, and is it a part of positive psychology?
Wonderful question. Thank you for the question. For the person who asked that. As it turns out, right now at the American College of Lifestyle Medicine, we're involved in a new grant where we are studying, we're doing a literature review, and we're looking at meaning, purpose, and spirituality / religiosity. and how it impacts health and well-being. So I'm actually just now going through the results. We have just after culling it down, under 400 studies. A lot of it relates to helping individuals with cancer and other more terminal diseases coping, but there are also preventive aspects. And we are actually going to be having a summit next spring, where we're going to be making clinical recommendations for using spirituality in addition to meaning and purpose, and how to best do that. So that's my long-winded answer of saying, at this point, yes, positive psychology in the broader umbrella can include spirituality and religiosity.
Great. There's a question about, if journaling can help improve positive psychology or health in patients. Can journaling help?
Can journaling help? I love that question as well. So expressive writing, if you're not familiar with the researcher, very famous researcher, Dr. Pennebaker, who's done a lot of research with people who have experienced trauma, who are asked to write on a regular basis for a few days, kind of stream of consciousness for 15, 20 minutes every day for a few days, and the impact more as for the trauma experience. But separate from that, it can be very beneficial for our well-being to be able to reframe. And what I say in expressive writing and journaling is asking yourself positive questions. So it's kind of a gratitude practice for yourself. What has gone well today? What's going well in my life? What can I build on? What are my strengths? And to journal around that can be very powerful.
Great, thank you. So a very relevant question for our patient population. Basically, in your experience, Dr. Lianov, how can we keep pushing and giving positive support to the patients? Because some patients, they're not very open to talking or venting, and some just might even refuse positive thoughts. So what can we do, to help such kind of patients or encourage them?
Very good question. I always in medicine, we joke a little bit, but it's that 80-20 rule. So whatever we do in medicine in general, it can help maybe about, if they take it seriously, 80% of patients, and then about 20%, a small percent, just are not willing to engage and maybe not be able to benefit. And that certainly is the case for positive psychology. For some people, this idea seems foreign and they're not willing to engage. But that being said, we don't have to call it positive psychology. We don't even have to ask them to do anything. We can start to role model in small ways in the clinics, like I said, with short positive interactions, or just asking what gives them joy, what gives them meaning, and having a short dialogue that way. And I bet that will remain in their minds. My doctor, my nurse asked me about this. This might be important for me to pay attention to.
Great, thank you very much. Any thoughts about how we can apply positive psychology in postpartum depression cases?
Yes, well, I actually looked at the literature for all phases of life in females and positive psychology, and there's very little literature, and so we need more research. But there is a tiny bit around postpartum depression, and it is positive in the sense that, like any mental health condition, if we can find one aspect of positive psychology that engages the patient in terms of looking inward for their strengths, then they'll make progress in their well-being. So what I mean is that with postpartum depression, their lives, in any life, when things change, the outside world changes, and of course, becoming a mother, your whole world changes, and it can be quite stressful and traumatic. And for some women, that leads to depression. That sometimes starting with looking inward and taking some of those positive psychology approaches is a good place to start. Like, what do I have in me to give me the strength to move forward. But again, honestly, we need more research. We don't have a lot of research.
Sure. So there's another question about how can you, what can you say to those, people who are stressed and they're basically diverting their stress into poor eating habits, then, gaining weight. So how would you help those kind of patients maybe with positive psychology?
Wonderful question about this relationship between mood and unhealthy habits. And that is the crux of it. And so what often does happen is someone is stressed, anxious, depressed, and they're going to sit on the couch. They're going to eat unhealthy, and that becomes this downward spiral instead of the opposite of that upward spiral I showed. And so in sometimes the best way to do that is, again, to start small and maybe ask some questions of, is there one small thing that you do that gives you joy or gives you a sense of meaning? And what is that? It's going to be individual for everyone, and to build on that. And so refocus on that, build a little bit of those kinds of emotions, and then start to connect that with the habits. So when you're feeling more positive, you probably will feel more strong to avoid those unhealthy habits, and build the positive emotions in association with those positive habits. But starting small. And I should say, I didn't get a chance to talk about this, but it's very important that joy and happiness and depression operate in different parts of our brain. So even if someone is depressed, they can experience moments of joy because that operates differently in the brain. So absolutely, no matter who it is, we can ask that question and ask, is there something that gives you a little spark?
Sure, thank you. So there's a question about if positive psychology is focusing on well-being, is it actually basically abandoning suffering, which is the focus of psychology? Maybe you can embellish a bit on that.
Yes. So remember, I was talking about emodiversity and talking about our human condition. And our human condition is that we experience all emotions, including deep, deep suffering and deep depression. This is normal existence. And in positive psychology, we're not saying be positive all the time. In fact, there's a term called positivity toxicity. And yes, where people say, I have to be positive all the time, but it's not what I'm feeling. You're forcing me. No. We start with where we are, whatever those emotions are, whatever that suffering and cause of suffering is. We acknowledge it. We have self-compassion. We have kindness to ourselves, kindness to others, and slowly gently redirect to activities and thought patterns that help us then bring that joy. But yes, we have to start where we are.
Right. I know we are a couple of minutes. I'll just take one or two more questions if that's okay with you, Dr. Liana.
Sure.
So
No problem.
I know you alluded to, that they're doing additional research, to see what kind of activities work in specific populations. So the question is about that are there specific populations that really benefit most from positive psychology in lifestyle medicine?
Yes. Remember, I was alluding to the fact that the way I've been presenting positive psychology in the PERMA model was developed by Martin Seligman, who's in the United States and University of Pennsylvania. So it has a Western bias. And so the interventions in the various studies that are built in that way with that Western bias do actually have greater impact, greater benefits for Western populations. But again, that being said, we now have more and more studies in other populations. We need to build on that and maybe get more back to traditional wisdoms of Eastern cultures, and I'm sure that we will see similar effects.
Sure. So again, of course, your talk was focused towards healthcare practitioners, but there are several questions about, how we can apply this to healthcare practitioners ourselves and also in daily lives. So what is your last thought on that? How can we do that for ourselves also?
As very busy, dedicated practitioners who also have family lives, and we have very full lives, we sometimes are like, well, I don't have time to engage in any new activities. Forget the hobbies, forget this, forget that. And I chuckle because, of course, I can relate. I'm busy as well. It's then in our daily lives, just a simple, maybe not so simple, takes practice, reframing and looking for strengths in ourselves and in others, looking for moments when things are going well. That is the definition of positive psychology, is focusing on strengths, not on weaknesses. It's not ignoring weaknesses, but as we go throughout our day, whatever we're doing, just be more cognizant of that, because the negative, the bad experiences are very sticky in our minds. We're programmed that way as a survival mechanism. So some bad interaction happens with a coworker, and that sticks with you the rest of the day, and it bothers you. So to try to reframe, well, what else happened that was good, that was a positive interaction, and let me refocus on that. It's a great place to start. Just refocus.
Great. I think that's a wonderful point, to stay focused, be in the moment, and go with the flow then. So of course, like you said, we are not negating the negative emotions that we have, but trying to be positive, looking at things from a different perspective. So
exactly. Well put.
yeah, thank you so much. I think it was a great session, and of course, it's a session, I'm sure you can speak hours on it. This was just an introduction, and people who are interested, they can definitely, go and see what this is, what the field is about. There's a lot of evidence on it, so it's very evidence-based. Yeah, and we would like to thank you from Weill Cornell Medicine and from the Institute for Population Health, Dr. Mamtani, myself. We are grateful that you could do this talk for us.